Hello and welcome to another video by ChalazionTreatment.com. Please be sure to stop by our website and discover how you can eliminate your Chalazion cyst in less than 2 days without expensive and painful surgery. There are a few Chalazion removal options to consider if you're one who suffers from this condition. A chalazion is a cyst that usually occurs in the upper eyelids, and while normally painless and benign, it can be disfiguring to the face and cause serious self-esteem issues. When warm compresses, antibiotic eye ointments, and eye drops aren't working, and the chalazion is already impinged on the cornea, blurring your vision, then it's time to consider removing it. However, cases of a chalazion growing to such an extent so as to cause vision problems rarely happen. Most of those who go through a chalazion removal procedure do so because of cosmetic reasons. Having bumps or nodules in the eyelids isn't exactly a mark of beauty, and surgical removal offers a quick and painless way to get rid of this unsightly problem. A surgical chalazion removal procedure is regarded as a day procedure. Unless complications arise, a person undergoing the procedure can go home immediately after the removal of the nodule. Rarely is a chalazion removal done under general anesthesia, except in children to ensure that they don't move and damage the tissues of the eye. Because a local anesthetic is applied, you will feel that something is being done to your eye, although there is no pain. In the case of a small chalazia, the cut is made at the back of the eyelid. The cut is only about 3 millimeters and does not need any stitches on account of its very small size. If the chalazia are larger, the cut is made in front of the skin and closed with very fine stitches that are hardly visible. Once the cut is made, the lump is then removed before the wound is closed with stitches in larger chalazia. In smaller nodules that do not require stitches, pressure is applied to stop the blood from oozing. It is standard procedure to have the lump sent to the laboratory to check if it is cancerous or not. In many cases, chalazion surgery is not necessary. This is especially true of smaller lesions that can be taken care of by a combination of massaging the affected area around the eye and applying warm compresses for 10 minutes 3 to 4 times a day. Doing this can sometimes facilitate the drainage of fluids, which can ultimately remove the chalazion. A common pharmacological approach is the application of antibiotic ointment or eye drops to cure the infected area around the chalazion. Doing this lessens the swelling and allows the clogged ducts to open and release the oil that has accumulated therein. Another chalazion removal alternative is the injection of steroid medication into the chalazion. This reduces the swelling and eventually stimulates the ducts of the meibomian gland to open and release the oil trapped therein. Unfortunately, these non-surgical modes of chalazion removal are only effective in smaller chalazia. When the nodule is too large, however, there is no other option from the point of view of Western medicine except to go for surgical removal. When there is no other chalazion treatment option left aside from a surgical procedure, there are a few things that you should prepare for before and after the operation. First of all, make sure that you know all there is to know about your impending operation. Ask your eye surgeon about the procedure, what you can expect to feel, and about aftercare procedures which need to be followed in order to care for the wound. While this will also be explained to you afterwards, it's best to know things beforehand so that you are in an absorbent frame of mind, not when you're already groggy with anesthesia. It is standard procedure in those preparing for surgery to quit smoking and cease taking blood-thinning medications like aspirin, which can cause bleeding while you're on the operating table. Your doctor will advise you regarding which medications you can continue taking and which ones you need to stop. Make sure that you read the consent form that you will be asked to sign thoroughly and ask questions if there are things that you do not understand. After the chalazion removal surgery, you are usually given pain medication to manage post-op discomfort. You will also be given eye drops or an ointment to apply in your eye to prevent infection. You must take care not to get your operated eye wet for a few days after the operation. Your doctor will tell you how many days. Also, you will not be able to wear eyeliner or eyeshadow in the operated area for at least a month. Once the pad has been removed, usually anywhere from 8 to 24 hours after the operation, you can begin doing light work. However, heavier activities will have to wait until approximately 10 days after the surgical removal. While eyeglasses can be worn after the patch is removed, contact lenses are not allowed to be worn for a number of weeks. Ask your doctor to be sure. While you can drive a day after the surgery, make sure that you arrange for someone to pick you up immediately afterwards. Any anesthetic, even if locally applied, can cause drowsiness and other side effects, so it's best to let someone else do the driving for you. In the event of bleeding or extreme pain, make sure to call your doctor immediately. For those who are too scared to go under the knife, an alternative method is to turn to homeopathic medicine. This method does not require injections or surgery, but promotes the body's natural healing mechanisms to cure chalazion. With the proper homeopathic remedy, experts in this area claim that not only are chalazion removed, the individual predisposition to forming styes and chalazion are also cured. Surgical removal of a chalazion is not necessarily a permanent fix to the problem. There are cases when the chalazion will return. In fact, those who have chalazion have increased chances of other growths in the future. However, practicing good hand and eye hygiene can help to prevent reoccurrences. So make sure that you always wash your hands and remove makeup, especially eyeliner, before going to sleep. As you can see, there are several chalazion removal options available, and we hope that this video has done a good job of explaining them. We hope that you've enjoyed this brief video. Be sure to visit our website at ChalazionTreatment.com, where you can download our step-by-step solution for getting rid of chalazion cysts. Our easy-to-follow method is painless, all-natural, non-surgical, affordable, and effective.